Lead us from untruth to truth, from darkness to light, from death to immortality, to peace, peace, peace.
Hello, viewers. I'm Chatra Krishnamurthy, the director of Nrityalaya, School of Indian Classical Odissi Dance in Potomac, Maryland. Welcome to the Nrityalaya webinar series, Pursuing Passions to Heal, Her Story and Our Stories. While COVID-19 has presented many challenges, we have proceeded with choreography and would like to share with you some glimpses of the upcoming show. In the fall, we will be presenting Her Story, a dance portraying a woman's battle to overcome darkness by rekindling her passion for dance. To shed more light on the topic of depression, we are conducting a series of webinars. To moderate today's webinar, I will now call upon one of my senior dancers and teaching assistant, Dr. Kosha Shah.
Hello. We now present the fourth pre-production webinar. We have assembled an esteemed group of panelists. The panelists include speakers who have openly talked about the malady called depression that has challenged them. The panelists also include a therapist, a psychiatrist, and an advocate who will give us further insight into the starkness and the healing and recovery process. We are calling these initial conversations pre-HERstory webinars, as these very same panelists will talk about their different paths to healing in the post-HERstory webinars. We will keep you updated and take this opportunity to invite you to view our presentation of Her Story. We hope you'll join us at the online premiere. Recovery might not be the word that I'm looking for. I think I mean healing and the healing process. I am convinced that with the different kinds of help available these days and with modern technological innovations, we will conquer and move forward, and I'm positively cheering for hope in the future. Let's start our conversations with the panelists. We will conduct this discussion as a Q&A session. We are honored to have such a diverse panel today. I would like to introduce the speakers and healthcare professionals here with us. Our speakers are Ms. Yurei Moon, Ms. Savina Suri, our healthcare professionals today are Dr. An Thuy Lee, and Dr. Janice Bray. In addition, we are honored to have a guest panelist, Ms. Emily Rosado, an advocate for providing mental health care to low-income residents. Thank you all for being here with us. I would like to start off this panel discussion with a few questions for our speakers. Ms. Moon, in the fall, we will be seeing and hearing about Her Story, our dance production. Today, we would like to hear from you about your story. Please share it with our viewers, addressing the following points. What were your experiences with depression? Did any specific event trigger depression? or was it random?
Thanks so much for having me on this panel and for holding such a wonderful and important event. It's difficult to say, as someone who has struggled with anxiety and depression my entire life, if neurologically and biologically this is something that I was predisposed to simply because of the way that my brain is wired, or if I experience most of my symptoms because of environmental causes, such as traumas. I experienced trauma very, very early on as a small child. I did experience some abuse from a distant family member that occurred when I was probably 4 or 5 years old. And that, of course, either exacerbated or triggered mental health challenges that I really, really was not able to name, and the grown-ups in my life were not able to identify because of lack of understanding and awareness. And as I got older and endured continuous traumas, including chronic illness, I am a cancer survivor, as well as abusive and toxic romantic relationships, I became more aware of the ways that my life situation and interactions I had with other people and health challenges impacted my mental health. And you know, when I look back now, after many years of having been diagnosed and receiving really good therapy and having access to tools and resources like medication and a supportive community, and my family now understanding my mental health care concerns, I do feel like from a retrospective view, everything makes a lot more sense, not only to myself, but also my family. Once we were able to more clearly identify and name some of these mental health challenges, my parents have made comments such as, "That's why you were so anxious as a child. That's why there were so many unexplained moments for us when we could not identify what exactly was causing that fear or that nervousness, or the ways that it manifested in my body, such as really intense stomach aches." And so I'm really thankful that I've gone through the journey that I have. But of course, when I think back to my younger self, I do wish that my community, my immediate family, and those who surrounded me, including my teachers, were able to earlier identify some of the challenges that I endured. But I certainly am surrounded by wonderful resources today.
Thank you, Ms. Moon. It does sound like a very challenging time for you and the family to identify what was going on. I'll now ask the same questions to our second speaker. Ms. Suri, what is your story? Please share it with our viewers, addressing the following points. What were your experiences with depression? Did any specific event trigger the depression, or was it random? Over to you, Ms. Suri.
Hi, thanks for having me. I'm so excited to be in this space and be able to just talk about this. So I personally, again, similar to Ms. Munn, a lot of the similar sentiments. I personally don't know if there was a specific event or just something related to like the biology of like how my brain functions, but definitely when I was an adolescent, I started exhibiting symptoms of depression, but it's a little difficult to tell what's going on when someone's, that young, and it continued to progress like in high school. And again, I would always tell myself, it's not that bad, I'm fine. And, I functioned and, did all right in, school and such. And my parents, their understanding of what depression is was very different. There's a cultural difference, as well as the sort of feeling that it has to be something really severe for it to be called depression. And so as I moved into college, you have less structure. So I was just really confronted with myself and how I did things. And it was really difficult. I just knew something was wrong, but I couldn't figure it out. And I was fortunate to receive professional care starting when I was maybe 15, but just had real doubts about whether there was something wrong, with my mental health, or there was just something horribly wrong with me. And that's just who I was. And while my family really wanted to help me and knew something was kind of off, they just didn't really have the knowledge and understanding of what depression is like. They only really understood this very severe sort of thing. And I sort of put my foot down once I got towards the end of college and was like, it just can't be like this. This is just too difficult. And I sort of had to lie to myself a little bit, like, no, like, do it. Like, this is a problem, even though I was sort of telling myself, no, like, what if it's not a big deal? Like, and I sort of have to a little lie to myself a little bit to just get to that step again. And so when I started seeking treatment again, towards the end of my college experience, I had a really different mindset of you know what, we're just going to try it. We're just going to do this. We're just going to go in with the idea of something's wrong and we're not going to doubt it. And it took a really long time to feel that way, especially when you're young. Understanding yourself is hard. You trust the people around you. And I grew up with a really loving and supportive family. So of course I trusted what they said. And so once I started seeking help with that mentality, and I had gotten older and was more independent, and could really advocate for myself better, I finally felt I was getting better. And looking back on it, I can't even believe I thought nothing was wrong. And I'm so proud of myself. I can't even imagine how I was able to come to that, space, because I was just really struggling with my mental health at the time. But I'm really glad I pushed and I advocated for myself. And it was difficult, but I feel so much better now, and I feel so much more like myself. And it took a really long time, but I'm so happy for having sort of the resources around me and just the genuine support of having my family, and just having a community that was concerned about how I was doing. And sort of that's how I've gotten to where I am.
Thank you, Savina. It's definitely a confusing time sometimes, and the first step is often acknowledging what's going on with you. And it was very brave of you to move towards a direction where you could seek help. Both of your stories are very moving and inspiring. I want to now turn to the healthcare professionals to get insight on the speakers and experiences. Dr. Lee, what have your experiences been with depression in the community? Over to you, Dr. Lee.
Hey everyone. So I really appreciate the opportunity to be a part of such an important panel. I just want to reflect kind of what has already been said, that depression is, it's an affliction that affects a lot of people. And I think oftentimes it's a spectrum, right? So we sometimes fall into this trap of thinking that it has to be really severe, it has to present a certain way. And so Ms. Moon and Ms. Suri, I think their stories are really reflective of kind of what I have seen in the patient populations that I've worked with. I work primarily with youth and adolescents, and so that involves a lot of work with families and caregivers as well. And so the kind of things, the presentation really varies, right? I think there's sometimes an assumption that something really awful has had to happen in order for somebody's depression to be warranted. But that's not always the case. And I think it is really tricky to tease apart kind of the organic causes. Is this a chemical imbalance? Is this because trauma has happened in our lives? Usually in the mental health field, right, it's a combination of all of those things. So I think that's really important to kind of keep in mind. But in terms of what I'm seeing in the community, it's especially with the pandemic right now, a lot of people, you know, who may be predisposed, these things have really been exacerbated. And so they might be experiencing maybe more clinical presentations than they would normally. I think that's really important to keep in mind as well, that, you know, but even with that, it doesn't have to be something as intense as a global pandemic for somebody suffering, right, to be justified, or for it to be okay to seek help. And I think that's a line that a lot of people that I work with struggle with. You know, there's a lot of youth that I see that say, I have a really great family and I have a great support system. There's no reason for me to be feeling this way. And so kind of what Dr. Shah was saying, that acknowledgement and I think validation of those experiences is kind of the most critical first step in terms of how to keep somebody, some of these families and these kids engaged in treatment, engaged in care. There's also a lot of psychoeducation, I think, that needs to happen with families and caregivers. So you guys have touched on some of the important things in terms of intersectionality. You know, if somebody has a different cultural lens, we may think about mental health in really different ways. And so it's very important for us to all be on the same page about like how this illness can manifest, right? I know in a lot of Asian American communities, people often somaticize. And so it might be that they first go to like a pediatrician for their kids, or they go to their primary care, and that's where we're seeing it first. And I think keeping all of those kind of nuances in mind is something that's really important, that's kind of emerged from the work that I've done with the community.
Thank you, Dr. Lee. Dr. Bray, what have your experiences been with depression in the community?
Well, first of all, good morning. And I appreciate being able to gather with this panel and with the entire organization and the mission of the organization. So I really want to thank you for including me today. My experience with depression and mental health in general has been like the things that have been mentioned before, is that people don't say anything when there are things that are going on that they internally feel are not necessarily normal. And so I want to help people get to me, I think is one of my goals. And so I extend my thoughts and thank yous to being able to include me, because I am usually the last stop. I'm a psychiatrist, and the field of mental health has so many helpers and so many professionals that sometimes it's hard to know who to go to. And so my experience has been, there are very few people, that actually get to a psychiatrist, and you are always told, oh, there's just no one to see you. And so in saying that, I'd like to give a definition of what people should think about when you're trying to discern what is real depression and what is just the blues. Because depression is common, it can affect anyone, it's not a character flaw, and it could affect your mental and physical abilities. So depression is a medical condition, just like other medical conditions. It can be treated and managed. the first step to recovering from depression is to have an open and honest conversation. Say something. And if there is no one around that you feel comfortable with, whether it's friends, whether it's dance therapists, whether it's school teachers, whether it's uncles, aunts, is to say something. And that something can be as small as I'm sad. The issues with depression is that it's more than a temporary sadness and other emotions that often follow the loss of someone or when you're going through something difficult. It's a little bit more, it affects thoughts, it affects your feelings, and it affects your behaviors as well as your physical health. So people with depression may experience several of the following symptoms. And I just want to outline these symptoms that maybe we all know about, but from my world, it's hard to know what is myth and what is passed on as fact. And so the one thing that we always have to think about is if you have a myriad of symptoms all day, every day, that's quite a bit. One feeling all day, a heaviness all day is concerning, but all day, every day for at least 2 weeks, then that should be our mark to say, I need to talk with someone. I need to tell someone what's going on. And these are the things that can indicate you're depressed, and it's more than just a feeling. Thoughts of death or hurting yourself. A persistent sad mood or down mood, often called the blues. A loss of interest and pleasure in activities that you usually enjoy. Feelings of hopelessness, worthlessness, guilt. Feelings that you just can't sleep or that you want to sleep all day no matter what's going on. A loss of energy, feeling tired all the time, or extreme changes in your appetite, you're eating everything. And I know this happened a lot with COVID, and people were trying to go to the refrigerator feeling they were justified because the supermarket ran out of food. And so, okay, we finally got normalized, and that was our normalization. But that in itself may have been an indication that there's so many people that were anxious for so long that depression had set in. Sometimes you can have no appetite at all, which is unusual. And then along with that, think about problems with concentrating. You can't remember anything. This is just not you. You usually remember names. You can't make decisions. You don't know what to wear. You don't know how to decide what you will eat. You are just in a fog and you don't want to make decisions. And so these are some big things that we should think about all day, every day, for at least 2 weeks to know to ask for help.
Dr. Brave, thank you so much. Also, I want to highlight the important comment that you said that depression is not a character flaw. This is so important for our viewers to hear. Thank you to both of you and Dr. Lee and Dr. Brave for your thoughts, and from the speakers, your own experiences of depression. Ms. Rosado, being an advocate for providing mental health to low-income residents, you might have a different perspective to our discussion. Having listened to the speakers and the healthcare professionals, would you please tell us the impact of your depression or the impact of depression from your view? Over to you.
Thank you so much, Dr. Shaw. Again, I'm so excited to be here. Thank you for inviting me to be on this panel and to just have these really important conversations. You know, I think over the past year, the pandemic has shed light on a lot of things that, you know, many of us already knew, but things that weren't necessarily talked about. And, you know, as far as impact of depression, I mean, it can impact every aspect of your life. You know, like Dr. Lee said, and Dr. Bray and our guest speakers, it can manifest in many different ways, right? So, you know, the somatic symptoms like headaches, stomach aches, and the emotional symptoms of hopelessness and worthlessness, which are really difficult, especially for young people. And as an instructor, I do see a lot of this in my students, and you know, and in the school setting, of course, inability to focus or concentrate, inability to make deadlines, inability to communicate, right? I think it's important for us to remember that sometimes it's hard to articulate those feelings of sadness and hopelessness, especially if you feel like you don't have the support of people who are close to you, because I know that's a really big part of healing and recovery. So, I think the impact is far reaching. I think the good news is that it's treatable. And I think that, it's our duty and our obligation to have these conversations and to keep them in the forefront so that we can start to normalize talking about, like Dr. Gray said, like, I feel sad, right? I feel anxious. I need help, because that's the only way really that we can continue to fight the stigma, which I know prevents many people from seeking help. So it can impact, every part of one's life. But again, the good news is that there is help. And I know we'll talk later about access and other things, but I just wanted to end on a positive note.
That was so informative. Your perspective is so valid and real. I want to get back to the speakers now. So, Ms. Moon, did you face any stigma that deterred you from seeking help? And if so, how has that affected you? People say oftentimes, snap out of it. Can you really snap out of it? How would you perceive this? Over to you.
Thanks for the question. No, if somebody is clinically depressed or anxious, you simply cannot tell yourself or have somebody to tell you to snap out of it and then just immediately shed those symptoms and the root causes of those symptoms. But I have been told multiple iterations of that message throughout my lifetime from folks who were well-intentioned, but unfortunately not adequately informed on mental health issues. And so I do think that coming from an East Asian family, and others this morning have addressed, as Dr. Lee said, the intersectionality that needs to be considered when we're talking about mental health issues. East Asian culture is very, very based in Confucianism, in putting your head down and working hard and respecting authority, and sort of like seamlessly being a part of society without sticking your neck out too far, not causing problems, not being a burden on others. And having grown up with parents who had those ideas instilled in them, I oftentimes felt that I did have to suffer in silence, because I did not want to cause problems for especially the grown-ups in my life. And so that served as a tremendous challenge for me. And then the other intersection there is the gendered aspect of this, right? I think many times in our society, we view mental health challenges within men and women, and now the conversation is broadening to those who are non-binary or somewhere along that spectrum of gender, right? And so it can present different ways and it can be perceived different ways. So I think as an East Asian American woman, I did feel that I needed to bite my tongue. I did not feel like I could ask for help. And so in that way, I think that the stigma, even if it wasn't so much that folks around me told me that I could not be experiencing these symptoms, that it wasn't allowed, or that, I was told that I shouldn't ask for help, I do think that it was deeply internalized because of my culture. And I do have to say the causes of so much of my mental health issues, right? Sexual abuse, narcissistic partners, right? cancer, a lot of these major sort of crises, experiences in somebody's life. I mean, the root causes of my mental illness themselves, separated from the mental illness and the way that it manifested, the root causes, those traumas also are stigmatized. We don't talk about those life experiences as openly as I think that we should, and that is why I gladly accept opportunities like this, because I do want to normalize talking about these traumatic experiences, so that folks understand, whoever is listening out there, folks understand that many times this is out of our control, and it's okay to, as Dr. Bray said, ask for help and simply state the feelings that you are sitting with.
Thank you so much, Ms. Moon. Ms. Suri, how did the stigma of depression impact you from reaching out to others and seeking help? How did you overcome this stigma?
So I would say that I experienced a lot of rhetoric, really similar to what Ms. Moon was discussing, that, just being really explicitly told, you don't have depression. Depression is X, Y. Again, like coming from someone who just really cares about you, and also I don't think wants to see someone they love admit that someone they love has something really serious going on. And as well as just coming from a South Asian immigrant family, my parents and extended family who I grew up around, they worked really hard to get where they are, and there were difficulties. And so it was just sort of like, they did it, and look at them. I mean, what did I even have to struggle for? I didn't have to struggle for anything, and that made it really difficult for me to come forward. And I also did experience some backlash, even though it was very well-intentioned and it wasn't meant to be minimizing. And I would say just growing up in a suburban community that was majority like white, it was disappointing that, the teachers and caretakers around me didn't really push for things. It was observed when I was in high school that I seemed like I was having a hard time while I was doing fine academically. It was still, they noticed a change in my mood, but, I feel like they just didn't know what to do with me. They had never dealt with somebody from a South Asian background. And I was American. I was born here. My parents are professionals. They're fluent in English. What's so different about me, And I think those cultural things, and just growing up in a space without people who look like me, really made it difficult to get the help I needed exactly when I needed it.
Thank you to both of the speakers who have been forthright with their experiences with the stigma attached to depression. We will now delve into this a bit more by asking the next two panelists about their experiences. This question is addressed to Dr. Bray and Dr. Lee. When one has a broken bone, we help the injury heal with a cast. Medicines, physiotherapy. When one is ill with, let's say, the flu, we let the illness heal with medicines, fluids, and rest. However, when one suffers from depression, why is there such a stigma attached to it? What are some barriers, including stigma, that you encounter that inhibit people from seeking help? Let's start with Dr. Bray this time. Over to you.
Well, physical illness and any illness is not necessarily something that we embrace. No one really feels good about being ill. It makes you feel vulnerable. It also conjures up those feelings of being weak. You get diagnosed with breast cancer, you don't want to tell anybody. You have a sibling that has to be in the hospital for some medical reason, it's hush hush. So there is a stigma, but it's acceptable. And I think the biggest thing is it's not their fault. There is just this random set of genes and environment that we get exposed to that will cause a physical illness or an accident. When it comes to mental issues, there's nothing visible. And it is then thought of as, well, we don't see anything wrong, so you must be making it up. You must be feigning illness for secondary gain. You must be trying to avoid. And in that way, folks that are usually strong and usually can find nothing wrong with their lives, they feel really guilty about saying that they're sad or that their thoughts are racing so much and they haven't slept for 7 days, but they think there must be something wrong with them. And so they search internally. That causes a decrease in the people that will get help and the backlash that comes when someone that has everything that's so beautiful in their life come to this conclusion that they're sad. And so the stigma is because in mental health, you don't see it. And it's considered a weakness, a flaw in character. And there are lots of other societal views where this should not happen. And so I think it's because it's not a physical issue that sometimes there's a lot of gaslighting that goes on. And we could talk a little bit more about that.
Thank you, Dr. Bray. Next, Dr. Lee, for your thoughts now.
So I think I would like to kind of echo what Dr. Bray said. I think the biggest impediment is really kind of this unquantifiable thing that is happening to people, right? There's no blood test. There is no kind of concrete thing that you can hand to others to show them that, yes, this is the cause or this is the reason. And I think when there's that much uncertainty around a diagnosis, it makes people question it, especially people that don't have a good understanding that this, again, can manifest in a lot of different ways, right? And so I think sometimes that makes it really difficult for others to accept this as a medical diagnosis. And it also causes kind of the person suffering with depression to have a lot of internalized shame. You guys, the panelists have spoken about their own experiences, even from well-meaning family members and loved ones, but how these kind of implicit messages cause us to blame ourselves, or we have to have something to kind of pin this on. So I think a lot of that stigma, it is attached to this feeling of weakness or needing to like not understanding why we're struggling with something when there isn't an identifiable cause. But in terms of kind of broader, I think, barriers, I think it is also important to acknowledge more of like the systemic levels of mistrust, especially in communities of color, that also make it difficult for folks to reach out. Even in those that do reach out and get connected to providers, the quality of that care can vary. And so I think it's really important to think about also kind of cultural competency when we're thinking about services that folks are getting. So there's kind of the systemic barriers, right, that are happening to individuals, but then there's also that individual and kind of family contextual levels of shame or stigma or this culture of silence that surrounds it. And all of those things together make it really hard to seek help and stay connected to help.
Thank you. Ms. Rosado, can you speak to the stigma and other hardships and struggles associated with depression in underserved communities and groups?
Yes, of course. Of course, I would like to echo what Dr. Lee and Dr. Bray were talking about. In my own experience, as an instructor and as someone whose family, has issues with mental health, and as someone who works with a mental health organization, I don't think we can separate the stigma from, our country's history. centuries of institutional racism, of course, that's going to have an effect on so many things: stigma, access to care, treatment, once those patients do have care. I talk to students all the time who say that, oh, well, my parents don't believe in depression, or my parents tell me that I just need to, suck it up, or, my parents tell me I need to pray more, which of course is good. These are all good things, but, is that going to, treat a chemical imbalance or treat trauma, that may be unresolved? So, I think the media also plays a really big part in this, in the way that they portray minoritized communities, people of color, and I don't think we can separate that out from adding to the stigma. I think that, even with, something like I saw in the news the other day, Prince Harry, of the United Kingdom, was talking about generational pain in his family, and how, his father treated him the way his father's father treated him. And it's kind of passed down like these very like painful experiences. And I was watching the reactions on social media, and so many people were saying, well, like, don't air your dirty laundry out in public. Like, that's not okay, right? So it's like this silencing of people's voices and experiences that, especially hurt our minoritized communities, who don't often get a voice in many different aspects of life.
Thank you. All of your reflections and points are very valid and extremely useful. I'd like to go back to the speakers now. We'll discuss your specific journeys to healing after our dance production in the post-production webinar series. In HERstory, the main character, Her, is portrayed as an ordinary woman who is coaxed by her family, dance mates, and therapists to use her passion for Odissi dance to overcome depression and launch her on her journey to healing. My questions to both Ms. Moon and Ms. Suri are, could you have started your journey to healing without help? Also, since we're in the midst of a pandemic with innumerable challenges, could you please tell our viewers if the COVID-19 disease or the lockdown impacted your depression or your healing in any way? Ms. Moon, over to you.
So to answer your first question, absolutely not. I could not have started my journey when it started without the support of others around me. And I think about the very first person who suspected that I may have depression and shared their perception and their observation with me. And it was my freshman year calculus professor at Georgetown University. And at that point, I was already struggling with chronic illness. I had been diagnosed with cancer and dealing with many complications at that point physically. And this professor noticed that although I was scoring very highly on classwork assignments, homework assignments, and tests, I wasn't showing up to class enough. And eventually, after several absences, he called my dorm room. This is back when we had landlines, and every single student's number was listed in a directory. And he called and said, I would like to talk to you about what's been going on. You're performing well in class, but you're not showing up. And when I explained to him that I simply could not get myself to get out of bed once my alarm went off in the morning, he asked me, do you think you could be suffering from depression? And this is from a gentleman who did not know me very well personally, but simply observed my behaviors and was concerned enough to share that with me. And he referred me to our college's counseling and advising center. It's called CAPS, it's Counseling and Advising, or Counseling and Psychiatric Services. And that is where my therapy journey began. And, I try very, very intensely to be that kind of professor as well for my own students, to identify mental health challenges and try to serve them in any way that I can. And I'll just quickly answer the second question about COVID and the pandemic. Absolutely impacted my mental health, not only the isolation, but just the continued trauma of being exposed to Asian Americans being attacked because of xenophobia and racism and scapegoating, as well as continued assassinations of Black people by the hands of police in our country. Simply being bombarded with images and stories, get compounded, and those issues were compounded by being in isolation and not having a community to connect with and process with. Absolutely exacerbated my symptoms, and I had to find other ways of seeking care that were different from my normal routine.
Ms. Moon, thank you so much. Ms. Suri, I'd like to hear your thoughts now.
I would say I definitely would not have been able to do this on my own. And maybe while I didn't get immediate direct support, I felt supported in my life and safe and secure. And so because of that, I felt comfortable to ask and maybe put my foot down a little bit more, just because I have a family that I just feel such security with and know I can sort of ask for what I need and not, be kicked out of the house or something, which unfortunately maybe some people do have to experience. And I will say, just while you don't need validation from others, and that's not what's going to help you get better eventually, it's so comforting in certain moments and really help you sort of keep going. And I would say just having various people in my life who I could just sort of bounce off this idea of, you know what, I'm going to do this, and not being really sure about it, but them saying, yeah, good idea. And that really helped me. And with regards to COVID, I would say that it definitely has impacted my sort of journey with healing. It's taken a loop, I would say, and required different ways to find solutions. But again, I'm very fortunate to have access to resources during COVID, and at the same time, being able to just kind of focus on that at the same time because of isolation has also been helpful. So that's sort of been an interesting contradiction or dynamic of the pandemic for me.
Thank you both for your frank comments. They're so touching. Let me now ask Dr. Bray and Dr. Lee questions along the same lines. This last set of questions is addressed to both of you. Please briefly touch on the fact that help is now available without specifying what could be tailored to each individual. Also, how has the COVID-19 impacted depression in the community? We will start with Dr. Lee.
That is a great question. So there is, I think, kind of an interesting contradiction in the midst of the pandemic, in the sense that more people are suffering from either low levels of depression, right, or their baseline levels have been exacerbated, their anxiety, their depression, because of everything that's going on. So there's a lot more people struggling, but I do know that switching formats to telehealth has opened up the doors to a lot of folks that wouldn't normally have access to these services. I have seen kind of more consistent visits from a lot of families, things, because it gets rid of some of those barriers in terms of finding childcare, finding transportation. Obviously, there's still limited access for those that live in rural communities that don't have great internet service. So those are things that we still need to be mindful of, but that's also an interesting kind of contradiction that I've noticed has emerged in the midst of this pandemic. I will say that I think it's important to acknowledge that everybody is kind of struggling because of what's going on. For children, a lot of them are having difficulty because of the virtual format of school. They're isolated from their peers. There is that lack of connection. Some of them are really anxious and worried about getting sick themselves or their families getting sick. And then at the caregiver level, parents are juggling so much more than they used to, right? When your kids are at home all day, you have to find ways to keep them engaged while you're still managing kind of your own work, as well as like household duties and responsibilities. And so I think sometimes parents are bringing their kids in for help, to seek help, and they're not recognizing that they could benefit from some of those things as well. And so I think that's a really important kind of point that I'd like to emphasize, is that it's really important to be helping our children, but we also have to be taking care of ourselves, and that help is available right now in maybe formats that we wouldn't normally consider, but to encourage caregivers to be open to that.
And now, Dr. Bray, what are your thoughts?
Well, I have two thoughts from, and I would ditto that, in all of the things that this pandemic has brought out in making us change the way we access care, making us change the way we live our lives. Two things about that I think that are relevant. One is at the in-the-house level, and one is at the policy level. And the in-the-house level, it's that during COVID, we were isolated, we needed to change. There were some stressors initially about access to resources, and people were confined to live with the people they had chosen to be intimate partners with, and then spent more time with their families. And sometimes that was not good. And so there probably are lots of statistics that will come out of this pandemic in terms of domestic violence, in terms of increasing depression when you have been paired with a narcissist that regularly will blame you for the entire pandemic. And so there are bizarre situations that have been hidden from us because people have not accessed care. And I would like to also emphasize that there is an amazing number of people that have been compliant with care because of the telemental health, and because they don't have to get out, get dressed, show up in your office. You may be running late. The one huge piece is that when you get an appointment online, there is a time. And if that therapist or that physician is not accustomed to electronics, which a lot of us aren't, that physician will have to bring you in on time. From a policy level, I think what we're facing now is, as this country opens and as the world eventually will be open, is that this has been a really valuable tool for people that are depressed. It increases access. It increases the willingness to get online and not have to get dressed, not have to face another person. And so I think it has opened up of the world of access that we never would have opened because of our mistrust that people can actually work from home, and that therapy is effective through a video connection. And so I think from a policy level, we do all have to speak out to say, this is good for depression. And we're not sure if it's good to check your blood pressure and to get your lab work, but it's really good for mental health. And so this piece of what we have available through the pandemic may actually get shut down. It's considered an aberrant modality, but I think it's worth speaking up that this is a really amazing tool to help more people.
Thank you both for your poignant perceptions. And now, Ms. Rosado, what kind of advocacy would you recommend to our viewers? Over to you.
Thank you. That's such a great question. I think the first step to any kind of advocacy is to educate yourself, and to just familiarize yourselves with the issues, such as the cultural stigma and barriers to treatment, and how, systemic racism affects minoritized communities, and, lack of access, how that affects minoritized communities. Educating yourself, it could be just going to the local library and looking at some books. There are so many wonderful people doing work on social media, different groups that post and educate their followers daily on these issues. And to Dr. Bray's point, I think, starting local and getting in touch with our county council members can be a really effective way to advocate for people who need those services. We know that not everyone has health insurance, but contacting your health insurance companies as well to advocate for these telehealth services, right? Because they are so much easier for people. And I think, from my own experience, I've been told that they may end soon, once the pandemic is over. Telehealth may be a thing of the past, but I think that, again, educating yourself about the issues and advocating on the local level, to me, is the best place to start. We do have strong allies in our Montgomery County Council, but also, targeting our senators and congresspeople and also our insurance companies, and just making it known to them that this is really important to us. And this is something that we are going to continue to fight for. There are also organizations locally and nationally who look for volunteers all the time, for help, with the chat line or the crisis line, or, many other different initiatives that these nonprofits work with on a daily basis. So reaching out to them and seeing if they have any volunteer opportunities, I also think is a great way to give back to the community and to learn more about these issues.
Appreciate your responses, Ms. Rosado. Listening to all of you really has made it evident that depression in itself is a huge challenge. On top of it, COVID-19 and the events that have occurred these past 2 years and in previous years has impacted depression in a rather harsh manner. I realize we have a lot of picking up to do as a community. So this has been a great food for thought session. From this discussion, it's evident that the experiences are different, the manifestations of depression are different, and so the roads to healing must also be different. After all, no two people are the same. However, the patterns are similar. Speakers, you are very courageous presenters to talk openly about your experiences with depression. This in itself, as we talked about, is the first step, as depression is indeed very real and can affect anyone at any time, irrespective of race, gender, age, culture, ethnicity, sexual orientation. It needs to be dealt with, and the stigma associated with it needs to be removed. Stigma only deters the recognition of depression and its horrific outcomes. A big thanks to the healthcare professionals and our very own advocate. Tremendous insights into this darkness called depression. Thank you. Folks, help is now available. Remedies are many, and the pathways to healing and recovery are plenty. After the production of HERstory, the same panelists will assemble and talk about their varied journeys to healing. However, they warn us that there are no miracles, and it is not an easy process with simple answers. After all, Rome was not built in a day, and so too, the mindset takes time. Please be patient with yourselves, is the message that I'm getting from the panelists. Being an optimist, I foresee a future filled with stories such as HERstory, where Her shows us that pursuing her passion for dance helped her to heal. We now present a sneak preview to our dance production, HERstory.
Nrityalaya, the School of Indian Classical Odissi Dance in Potomac, Maryland, USA, presents HERstory. This multimedia conception will use the storytelling features of Indian classical Odissi dance, appropriate verbal explanations, and audiovisual effects to portray the story of a woman's struggle to overcome and heal her depression by rekindling her passion for dance.
I went through many challenging situations as a child and a teenager, including several rejections. As I grew into adulthood, I struggled with my inner demons.
Snap out of it.
Just deal with it.
I asked, "Show me. How do I do that?" Seeking help made me realize that I could rekindle my passion for dance to heal. Coming soon in fall 2021. HERstory, a dance production that revolves around the story of my life. While dance is my passion, what passions can you pursue to heal? Viewers, HERstory will be presented in the fall. Needless to say, we're very excited to have you join us as we explore HER's journey through depression and her healing process. Thanks for your patience. Thank you, panelists, for an animated discussion in this 4th episode of the Nrityalia webinar series, Pursuing Passions to Heal, titled HERstory and OURstories. This much-needed discussion has left us with many points to consider and ponder over, as these are indeed important conversations. On this slide, you will find the names and emails of the healthcare professionals and advocates who participated in our panel today. They would like us to understand that no one is alone, so do not give up, as help is only a click away. Thank you, viewers, for joining us on this very pertinent discussion today.
Viewers, stay tuned for the next episode that will air on YouTube. It will include another diverse panel that will present their stories and different viewpoints. Please help us spread the word. We definitely welcome and encourage participation in our webinars. So if you're interested, please send an email to nrityalia@hotmail.com with your name, telephone number, and email so we can contact you. Please put Nrityalia webinar series in the subject line to alert us to your interest. The credit for the webinar series goes to the Nrityalaya webinar team. Please check our website at www.odisseynrityalaya.com for updates. See you at the premiere of our dance show, HERstory. This is Dr. Chitra Krishnamurthy signing off from the 4th episode of the pre-HERstory webinar series, Pursuing Passions to Heal, titled HERstory and OURstories. Thank you.